If you have diabetes and you've ever noticed that weird blurry smudge right in the center of your vision, the one you can't just blink away, then this is for you. We're going to break down exactly what could be going on and, most importantly, give you a clear path forward.
And that quote just nails it, doesn't it? This isn't just about seeing. It's about recognizing the faces you love. It's about being able to read a book. It's about feeling confident enough to get in your car and just go. This isn't just a symptom. It's deeply personal. So if that feeling of what's going on with my eyes sounds familiar, just stick with us. We're going to move from that place of fear and uncertainty to a place of understanding and, really, empowerment. Let's trade that worry for a solid, concrete plan. Okay, first up, let's get really specific about what you might be seeing. It's so important to be able to name these things because they're basically crucial clues for your doctor. Now look, we're not talking about just general fuzziness here. We're talking about very specific things. It's that blur right in the middle that makes letters on a page look smeared. It's looking at something straight, like a window frame, and seeing it look wavy or bent. Or even just noticing that colors seem kind of washed out in one eye. This very specific set of symptoms is the fingerprint of something called diabetic macular edema, or DME. And here's the thing that makes this so sneaky. Your brain is an incredible editor. It sees the blurry picture from your weaker eye and just sort of papers over it with the clear image from your stronger eye. It's an amazing trick, but it means you can have a real problem developing in one eye and have absolutely no clue. It's why that simple little trick of covering one eye at a time can be so incredibly revealing. So we've covered the what, but now for the why. Why does this happen in the first place? Let's pop the hood and take a look at the mechanics. Everything revolves around this tiny but incredibly important part of your retina called the macula. You can think of it as the high-definition sensor in your eye's camera. It's responsible for all the sharp, detailed vision you need for reading, for seeing faces, for making out road signs. All the important stuff. Now, your retina has this amazing built-in waterproofing system. It's a barrier designed to keep fluid out of places it shouldn't be. But over time, high blood sugar can start to weaken this barrier, kind of like causing tiny little cracks in a seal. And that kicks off this chain reaction. First, high blood sugar puts a ton of stress on those tiny blood vessels in the retina. Then, that stress weakens the waterproofing we just talked about. Inflammation often joins the party, which makes the vessels even leakier. Then, fluid starts to seep out, and your macula soaks it all up like a tiny sponge. That swelling, that is what causes your sharp central vision to get blurry and distorted. Okay, so you know the symptoms and you understand the cause, but how does your doctor actually confirm what's going on? Let's pull back the curtain on the whole process so it's not such a mystery. Your doctor really has three main tools. There's the dilated exam, which gives them a good overall look at your retina's health. Then there's the OCT scan, and this one is the star of the show. It actually measures the swelling and shows where the fluid is. And sometimes they might use an angiography to map out the leaks. But the real gold here is that column on the right. It gives you the exact questions to ask your doctor for each test. That's how you stay in the driver's seat. I love this analogy. That vague feeling of, my vision just feels weird, is so hard to pin down. But an OCT scan, it gives you a number. It gives you and your doctor a concrete measurement of the swelling. It creates a baseline you can track. It takes a vague problem and makes it real. And more importantly, makes it manageable. All right, this next part is, and I'm not exaggerating, probably the most important piece of information you can get from your doctor's visit. It all comes down to one question that shapes your entire treatment path. That's it. 3 little words. Is the swelling center involved? All this means is the fluid right in the bullseye of your macula, that high-definition zone we've been talking about? The answer to this one question, it changes everything. And here's why that question is so critical. If the answer is yes, it is center involved, the urgency level goes way up. Treatment, often with something called anti-VEGF injections that stop the leaks, is usually started pretty quickly. If it's not center involved, the plan might be to watch it carefully or maybe consider a targeted laser treatment. It's the literal fork in the road for your care plan. So the bottom line is this. When you leave your appointment, knowing the answer to that center-involved question is your key. It takes a big, scary diagnosis and turns it into a clear, logical, step-by-step plan that you can actually understand and follow. All right, we have armed you with a ton of knowledge. Now let's turn that knowledge into a real-world action plan to protect your vision. Let's quickly run through some common traps that people fall into. First, the "I'll just wait and see if it gets better on its own" mistake. That's a huge one. Next is thinking, "Oh, I probably just need new glasses." That's not going to fix a leak. A really big one is stopping treatment just because your vision feels a little better. The swelling can come right back. And finally, don't forget, your eyes care just as much about your blood pressure as they do about your A1C. Now let's talk about timelines, and I want to be crystal clear. If you have a sudden change, a sudden loss of your central vision, a new dark spot that looks like a curtain, or serious eye pain, that is an emergency. That means you get help the very same day. Non-negotiable. For new wavy lines or a central blur that seems to be getting worse day by day, the timeline is soon. This isn't a 911 emergency, but it is time sensitive. You need to be booking an appointment to be seen within a few days to a week, maybe 2 at the most. Do not put it off. To make that doctor's visit count, you have to go in prepared. Here's your checklist. Have your current medication list, your recent A1C and blood pressure numbers, and a clear idea of when your symptoms started. And most importantly, have those 2 key questions written down so you don't forget to ask. This little bit of prep turns you from a passive patient into an active partner in your care. And that brings us to the very last thought. The simplest, fastest, most powerful thing you can do for your vision starts right now. Cover one eye, then the other. Look at a straight line. So I'll just leave you with this one question. Have you done your one eye check today?